I'd like to welcome everyone here today and acknowledge that we're on the lands of the Turrbal and Yagara peoples, traditional custodians of the lands and waterways of the Brisbane area. I pay my respects to elders past, present and emerging. Today we finally launch the Community Mental Health and Wellbeing Workforce Strategy 2024 to 2029. I felt that was fitting to launch this before I leave the Alliance, as it's one of the highlights of my time here. Today I'll introduce the project. Sandra Eyre will say a few words, and then you're going to hear from the Workforce Strategy team themselves. We'll then ask our chair to say a few kind words about me, and then invite you to join lunch with us in this lovely location. This Workforce Strategy project was funded by Queensland Health with the support of the Mental Health, Alcohol and Other Drugs branch. It's been about a year and a half, maybe nearly 2 years in the making. And we understand that this strategy is the first of its kind in Australia. So lovely that Queensland's leading the way. And we're really pleased to be leading this important work. We started it in response to workforce being the number one issue of our member organisations. And we embarked on a really extensive consultation process right across Queensland to develop the strategy with the sector and with other key stakeholders. We started with an issues paper, and there were many issues. The project advisory committee with many people here today were part of. The consultation was statewide, reaching well over 200 stakeholders. 6 face-to-face, 1 online consultation, as well as one-on-one interviews, and these were both metro and multiple regional locations across Queensland. We conducted some specific focus groups for multicultural and lived experience. And this was all backed up with a comprehensive workforce survey, which gave us really invaluable data about the community workforce here in Queensland. So the draft strategy was presented to the sector for feedback last November, and then the discussions began with the branch about how we might implement this. Now I'm pleased to say that Queensland Health has supported us to implement some of the key initiatives within the strategy over the next 5 years. We'll hear more detail about this from the team, including how you can be involved. And before we finish though, I'd like to acknowledge the QAMH team for their work on this project, and in particular, previous staff, Sally McLeod and Sarah Childs. And I'd also like to thank Sandra for being here today, and I'm going to invite her up to say a few words.
Thanks very much, Jennifer, and I'd also like to acknowledge the traditional owners of the land that we're on today, the Eyre and Turrbal people, and pay my respects to elders past, present and emerging. I'd also like to recognise people with lived experience of suicidality, alcohol and other drug problematic use and mental illness. And thank you for all the contributions you made to the work we do. I'm really pleased to be able to be here today and talk about this. And as Jennifer said, it's been, well, she said 1.5 to 2 years in the making, but actually the idea about this was really talked about probably 4 or 5 years ago. And as I'm pleased to say, the great minds think alike, because there was a really coming together of it being a key issue that needed to be addressed across your sector, but also in the department we've been really thinking about what we can do to strengthen initiatives and programs that are really going to support particularly the community psychosocial workforce that exists across all your agencies. As Jennifer said, Queensland Health are really pleased we've put $2.5 million over 5 years into this plan. And one of the really good things about this strategy is that there's really tangible actions in there, and actions that, as Jennifer said, she'll invite you all to participate in various elements of it. That includes the department. There's a number of actions in there for the department, including looking at a funding and costing model so that we can get a better understanding of the true costs of service delivery across our agencies. What was the other one, Fleur? We were just looking at them before. On the 5-year contracts, well, the Queensland Government has already acted on that. But, so there's a number of really tangible actions. And also the Commission, of course, and Michelle Sandra, who I can see here today, really driving the tangible actions around lived experience. Queensland Health has really invested in supporting community-based mental health workforce, and we really think it's a critical component of the treatment and wellness continuum. We, as you know, support our MHAOD Jessons to deliver clinical treatment through our treatment teams, but it's a really critical element of care that people need that's delivered through the sector, so we really think it's important to support. So congratulations, and on a personal level I just want to thank Jennifer. It's been great working with you. I can't believe it's 5 years, and I wish you all the best.
So I'm going to talk to you about the strategy itself. So the strategy development, as Jennifer mentioned, was informed by extensive consultation and a comprehensive workforce survey. What we learned through that process was that workforce shortages were the top concern for our members. 57% of organisations cited it as their primary issue. Over half of respondents reported inadequate access to training and staff development. More than half of organisations were very or extremely concerned about stress and burnout among their staff. 12% felt that the Certificate 4 in mental health adequately prepared staff for their roles in the sector. And the sector faces challenges in offering stable employment, with only 45% of the workforce employed on a permanent basis. These findings underscored the urgent need for a comprehensive workforce strategy and shaped the priorities that we have identified. The strategy itself is structured around 3 key pillars, each addressing critical aspects of workforce development. The first pillar is qualifications and training. This includes ensuring that core qualifications are contemporary and valued by the sector and beyond, establishing traineeships as a pathway for core qualifications, improving access to high-quality professional development, enhancing leadership qualifications and development opportunities, and standardising and professionalising our workforce. As an exciting side note, following the development of the strategy, we sought approval for the Certificate 4 in Mental Health and the Certificate 4 in Mental Health Peer Work to be added to the user choice funding traineeship list. We are really pleased that this has now been approved. Pillar 2 focused on attraction and retention. Priorities for this pillar was enhancing employment conditions, promoting the sector as an attractive career choice, increasing accessibility of vocational qualifications, enhancing diversity within organisations, maximising local resources and expertise, developing a clear progression of career pathway, and embedding a culture of work and wellbeing within the sector. The final pillar was on system enablers. This pillar focuses on system-wide factors that enable workforce development. The priorities for this pillar were ensuring adequate resourcing to enable the delivery of high-quality services, improving workforce data collection and utilisation, enhancing the visibility and value of the workforce, both within the mental health system but also the broader community, embedding lived experience across all organisational levels, embedding First Nations and culturally and linguistically diverse cultural safety and capability, fostering collaboration at multiple levels, not only within the sector, but between the sector and the broader mental health system, and also with education and training providers. And finally, ensuring the oversight and accountability for the implementation of this strategy. Overall, the strategy aims to create a contemporary, person-led and culturally safe workplace, equipped to meet the needs of Queenslanders struggling with mental health challenges. We're really pleased that Queensland Health has seen the value in this piece of work and have funded us to implement elements of this strategy. I'm now going to hand over to Yumi, who is the Senior Advisor of the Workforce team, to introduce her team and to talk about the implementation of this strategy. Thank you so much.
Thank you so much, Chloe. I'm delighted to be here and delighted that our strategy is finally launched. From all the things that Chloe just mentioned that are in the strategy, not all of them, we've not been funded to do all of them, like was said before. The Mental Health Commission will do very important pieces towards the lived experience workforce. For example, ensuring that the core qualifications are contemporary is a piece of work that Ability will be doing. And here in Queensland, we're also supported by industry skills advisors for check-up in that work. So what are we working on? Well, first of all, we're working on a plan that will create the overview of what we will do, when and how over the next 4.5 years. But also to give you a little bit of a tip of what we're looking at and delivering. With the review of the qualifications that are now approved, because the review of the Cert 4 in mental health and mental health peer work have now been approved for review, which is very exciting. But with that now kicking off, we really also want to do a piece of work on our core competency framework. The core competency framework in draft was developed alongside the workforce strategy, but it needs more consultations and more refinement. So that's definitely what we want to do with the sector and people with lived experience and lived experience workforce. On the other hand, we also know that people at this point already are doing the Cert 4 in mental health and mental health peer work. And we need those people. We need more workers into our sector. So to make sure that their experience in learning is the best it can be, we are already looking at a model for traineeships with Queensland, and we're also looking to work with other RTOs on this. Because we want to make sure that these new people coming into our sector, people that are looking to advance their career by doing these Cert 4s, get that experience of what contemporary service delivery in the sector actually looks like. And we believe the best way to do that is by actually working in the sector while learning their Cert 4s. We've also started I'm very glad to say that I'm not going to do this work and all the other work that's in the strategy alone. So I would like to introduce my team, two of whom are actually here today. So Chelsea has extensive experience in frontline community mental health service delivery, both across South East Queensland as in South Australia. And she has used all that experience to design, deliver the qualifications in mental health and community services for TFSA. She therefore will be driving our work under Pillar 1, which is qualifications and training, which includes the core competency framework and traineeships. Next to her is June. June also has extensive experience in frontline community mental health service delivery in Queensland, but also in South Korea. This last project was a piece of research on the bilingual and bicultural workforce in health and community services. So he brings all that experience and will be driving the work that is geared up to, on the one hand, support the wider community mental health workforce to provide more culturally capable and culturally appropriate services to multicultural and linguistically diverse communities in Queensland, and also to work with the sector and multicultural services to help grow and support the bilingual and multicultural workforce in our sector. Not here today because he's starting next week is Stephen. He will come on board to also work with the wider mental health, community mental health workforce on delivering culturally safe and appropriate services to Aboriginal and Torres Strait Islander communities, and to also work with the sector and community control organizations to help grow and support First Nations workers in our sector. I come to you with 20 years of experience in workforce development, have been doing that in Australia for about 10 years now, mainly with community services, supporting them in their workforce approach amongst the massive reforms and changes that the sector has seen over the last 10 years. But even with all our experience and knowledge that my team and I bring to this work, we cannot do this without your support and guidance. We need perspectives from all across the sector to help form what we are doing and how we are doing it to make sure we have the impact that we're looking to achieve with this project. So in the strategy that you're handed out at the registration desk is actually a flyer, a 5-minute flyer. That is an expression of interest for you to be part of the consultation that we will be doing throughout this project. There is a QR code on it. Please scan it, put your details down if you're interested in contributing to this work, and if you do, we will be in touch very soon. We will also be available over lunch to answer any questions about this project, and so please come and chat to us if you have the time. Now I would like to hand over to our board chair, Cathy, to take us through the other very important part of these proceedings.
Thank you very much. I too would like to acknowledge the traditional owners of the unceded lands here, the Eyre and Turrbal people. I also acknowledge people with lived and living experience, because that's why we exist, but I will also acknowledge families, kin and carers. Well, what I can say firstly is New South Wales game is Queensland's loss, as we have said to Jennifer many times. So I speak on behalf of the board. I can assure you that Queensland leads not just in the work we do here, but it leads nationally. And I am involved in that space, so I can guarantee you our voice, our work and our commitment to the sector is widely known across this country. Organisations don't lead by accident. Organisations lead because of good, solid, committed leadership. And that's what Jennifer has brought to the Queensland Alliance. She has surrounded herself with highly skilled people, as we have heard in this wonderful workforce strategy. She works very collaboratively. She works in a very strategic and collaborative way with the board, and that has enabled Queensland Alliance to progress. I've been involved with the Alliance since 2009 in one way or another, coming and going. So this is my third time back on the board, and each and every time I have seen the Alliance grow. But in this phase of our existence, we have really stepped up. And I think this example, it's just one piece of work that the Alliance has done under Jennifer's leadership around workforce, is critically important. And our sector is the sector that can stand up a workforce quickly and efficiently. And I think that has been recognised by the strategy and by the funding. It is really also good to know that our sector now at a national level has closed the loop. We are the only sector that has a peak for providers, a peak for lived and living experience, and a peak for families, carers and kin. That is something for us to celebrate, and I know at the Queensland level, Jennifer has worked extensively and very collaboratively with those peaks here in Queensland. Because as providers, and that's the body that we represent at Queensland Alliance, our job must reflect the needs of the people who use the system. And the community sector is where people live. People live in community. And our aim has always been, strategically from the board perspective, that people have the best opportunity to live hopeful lives, contributing lives, and lives of belonging and connection. And all of the work that you see the Alliance lead and you deliver does exactly that. But we're in a place now with great opportunity and great challenge, but with challenge comes opportunity. I'm very much a cup half full person. The opportunities for our sector to grow and improve the lives and create better lives for people and their families in our space is just incredible. So thank you, Jennifer, because you led us to this place with the Queensland Alliance. And at this point, I'd also like to thank Chris Sargent for stepping up as the interim CEO as we go through the recruitment process. I would also like to thank the staff for their support to Jennifer and having worked collaboratively with her, because as I said at the beginning, a good organisation doesn't happen by accident. It happens because we have good leadership and we have good people working within the organisation. So we are very, very sorry to see you go, Jennifer. 5 years has flown by, but we know our voice in the New South Wales Mental Health Commission will still be heard, and I am sure we will not lose touch with you. Thank you.
Just on behalf of the QAMH team, we have got some gifts for you to remember us by, wrapped in Barbie pink.
Excellent.
So these are from us. Thank you so much for your fantastic leadership.
For those of you who don't know the joke about the Barbie pink, there is a photo of me dressed as Barbie in the upcoming annual report. So that'll be something to look forward to. Who's Cathy? Where is she? Oh, Cathy. Thank you, Cathy, for those kind words. I'll just say a couple of things. It's been quite a journey for me personally and professionally over the last 5 years. I arrived at the end of 2019 thinking I'd just pop back every second weekend to see my family in Melbourne whenever I chose. And then COVID hit, which is really difficult for our family, like many other families. The silver lining was that I met my husband, Mike. Made it all better. But professionally, there's so much to be proud of. And there are two things in particular that I'd highlight. Our work developing a unique value proposition for the sector through Wellbeing First and creating the Innovation Hub to put these ideas into action has been a delight. Working with those services, putting these principles into action was amazing. There's still more work to be done though. The second was, of course, the workforce strategy, but there are many other things we've done that were highlights. But I'd just like to say a few thank yous to the sector. It's been a pleasure working with you and supporting the crucial work that you do. Many of you have been so generous with your time in your busy schedules to support our work, and I'm really grateful for that. I'd also like to acknowledge Cathy and the QAMH board for their unwavering support and belief in me to explore these challenges and ideas with the sector. And lastly, to the QAMH team. Sorry, I'm going to get emotional. They're an amazing, skilled professional group, always looking for ways to improve and add value, not only to QAMH, but to the sector as a whole. They absolutely live our values, and the past 5 years has been a great team effort. I look forward to catching up with you over lunch, and my phone number's the same, so please don't. Thank you.